Southwest that was delivering water on a parts per billion to their clients at 90 parts per billion. So EPA came in and said, okay, this is absolutely no good. You got to get it down to 50. The water utility said, we can't afford that. We're out of here. So everybody on the system was left with three choices. They moved, sold their homes and moved. They got bottled water, or they dug wells. Most of them decided to dig wells. The only problem with that was the naturally occurring water level of arsenic in the water there was 100 parts per billion. We had done nothing for human health. So it was an issue where the response was going to be different in different parts and different parts of the country. And the other side of a national water policy, because when you're trying to make a national policy, it's a one-size-fits-all. You have, science is not exact. I love scientists to death, but they're not exact. If they had told me that at 10 parts per billion everybody would live forever and 11 they die, it would have been no problem setting that standard. Even I can get that. They were saying between 0 and 25 parts per billion is okay. Well, every 5 parts per billion you pick up a whole new level of geographic entities, of water companies, of people that are being impacted. So you have to allow some range or flexibility. I mean, we set it at 10 because that's what I think is appropriate, and allow people to go at less. And I always said we were going to set it 10 and everything, and that's a different story. But, I mean, said we were going to set it less and the same timetable. That's a different story. But the point here is that setting a national policy, what happens when you set national policies like that is federal government is not really good at flexibility. And they tend to set very rigid standards if they were getting beyond just enforcement of something like the Clean Water Act to set a national policy. And it probably, you'd have more exceptions to the rule than you'd have the rule. And there's going to be a lot of pushback to that. I don't see an appetite anyway right now because, as I say, we have so much problem with just enforcing the regulations that we have to take it to the next level of a total policy. But I'm not sure that the agency could do it very well because the differences are so great across the country, and the needs and the challenges that you face. I mean, arsenic is a huge problem in the Southwest, naturally occurring, not so here. We got other pollutants that are big problems. You go to areas where you have communities that are largely for retired people. You start looking at what's in the water there. Everybody's getting their share of Viagra. They're also getting their share of heart medications and everything else because it's passing through our systems. Now, the other problem is when you start identifying things, which we've gotten much better at doing. We can identify all kinds of things in water, but we don't always know what it means. We have no idea at what concentration it's going to affect you, at what effect it is, what the effect will be. We don't know, and yet the minute you start to identify, people get very concerned, understandably. They hear there's something in their water that wasn't there before, and they don't like that, and everybody can understand it. The problem is, where do you set the limits, and how do you decide what's appropriate and what isn't? That's a very long process. So to try to do that nationwide on all the areas where you'd need to do it, if you were going to have a national water policy, beyond some very broad parameters, I think would be very, very difficult and time-consuming. It'd take a long time to get something like that in place, much less implemented.
Thank you, Madam Governor. I know that there are still many of you would like to raise questions, but since we are running out of time, of course, the availability of such a rich experience here would be endless in terms of the questions that I can think of and the answers that are so instructive that we all find here. But thank you so much, Excellencies, distinguished delegates, and the participants here. And thank you so much, Madam Governor Whitman, for your coming, for your very instructive and comprehensive elaborations in response to the keen interest that our distinguished delegates showed in this room at this conference. And I thank you, Professor O, for your kind and courtesy of presence here with Madam Governor during this special session on the occasion of our high-level international conference on the issue of water and global health. I thank you all. I think that we are not going to move. I will certainly escort Madam Governor out of the conference, but the next session will be resuming within another 2 to 3 minutes. So please kindly, with due respect of the time constraints, stay at your seats for the time being. Thank you so much.
To save time, I will not read through the bio sketch of the speakers, and I would encourage you to look into that at the back of the program. Also, at the closing of this session, we have a special presentation from the city of Ankara, who recently received an award on water, and we'll get to that toward the end. And I must offer my apologies for delaying the lunch, but I'm sure that you will definitely appreciate hearing the message here that we have, which is slightly different than the main conversation we have had so far, and fits very well with the discussion that Governor just had a few minutes ago. I understand there has been a lot of conversation about policies as well as partnership that requires to address some of the challenges. I felt that it would be valuable to hear directly from the companies, mainly for-profit organizations, that are actively engaged in this area by developing either new technologies, deploying those technologies, looking into innovative business models that can be applicable to point of use at a low cost and perhaps low-tech development, and more importantly, using some of the computational power for projection of the needs and modeling and simulation of future plans. With that in mind, again, I do not want to elaborate much more. I want to make sure that we have opportunity to hear from our speakers. Each speaker will provide an introduction of their firms, what they do, and some of the key challenges they see in this area, followed by question and answer. And we start with Kurt Sutherland.
Thank you for the introduction. I happen to be with the organization that Governor Whitman referenced a few minutes ago, co-founded by John Whitehead and also Paul Newman about 4 years ago. A couple of points of correction. She did a terrific presentation, but there are 2 points of correction. Each of the board members, you can see, quick introduction. Safe Water Network, it is a not-for-profit organization. We're focused on delivering safe water solutions to underserved populations and markets. The key priority for us, not the only one, but a key priority for us is around private sector engagement and how to mobilize private sector participation more fully in delivering affordable, reliable water solutions to the billion or so people who currently don't have access to safe water. Several of the things that Governor Whitman spoke about are, I think, extremely relevant to the topic at hand and capacity building. She mentioned about the need for sustainability, sustainable solutions, the need for appropriate pricing and covering cost recovery, the ability to deliver health outcomes to help these underserved populations. And I think much of this translates directly into the topic of this panel discussion around capacity building. We are Safe Water Network focused primarily on peri-urban and rural solutions. So I'm sure a bit different than what you'll hear from Siemens and IBM, although much of the challenges are very, very similar as it relates to governance, engagement of public-private partnership, delivery of sustainability. And I think that we're going to find, while different solutions and different applications, we're going to certainly find lots of commonality in terms of what we need to do to address those particular challenges. Much of this story I'm trying to bring to life through photographs, and I don't nearly do it justice just by talking. And I think particularly when we're talking about the topic of capacity building, which really does happen on the ground, in the field, it's really important to bring the conversation out of this sort of elevated ether of the United Nations right down to the ground in areas where we're working.